There are many important questions for you to consider when making a case to potential funders and setting up a system to sustainably finance and increase access to services. These questions are relevant whether you are starting from scratch or building from an existing program or service, as modifications to features such as program design or staffing structure may be needed to make an existing service scalable and fundable. Now let's look at some examples of these types of questions. What services will you provide? Will you provide home assessments, low-cost supplies to improve the home environment, self-management education, referrals, or counseling? What is the evidence base for these services? Who will benefit from these services? Will you provide services for children, adults, or both? Will services be targeted to Medicaid beneficiaries? To people with poorly controlled asthma? How will you define poorly controlled asthma? Are you focused on reducing health disparities and interested in providing services aimed at specific at-risk or underserved populations? What types of health and health-related outcomes do you anticipate as a result of putting these services in place? Do you expect to see a reduction in healthcare utilization, such as a decrease in the number of emergency department visits or hospital admissions? Will there be improvement in quality of life? Will there be improved school attendance, or will employees miss fewer days of work? What types of healthcare savings or benefits can be expected, if any? Do you expect any cost to increase as a result of the intervention? Will there be a cost saving associated with reduced emergency department visits or hospitalizations? How much will it cost to provide these services? Have you considered all possible costs, including the costs it takes to run and administer the services? How long will it take to realize health outcomes and savings? Can a potential funder expect a return on investment in 1 year, 5 years? How will you share results with partners, potential funders, and stakeholders to demonstrate continued savings and benefits? Don't worry if you don't have all the answers to these questions. You can build on the extensive information that other programs and initiatives have published about the costs, savings, and health impacts of home-based asthma services. Throughout this training, we'll walk you through a number of key resources and real-world examples to help you communicate the value of home-based asthma services. As you build your business case, remember to think about what is important to potential funders and payers. This will help you build the business case they want and need to hear.